Mrs. D is a 25-year-old single Caucasian female graduate student presenting today, February 7th, with a 1-month history of urinary frequency and intermittent pelvic pain that is now accompanied by 1 week of increased vaginal discharge, which sometimes has a strange color and a strange odor. She is currently sexually active and has had several sexual partners in the past year, with the last sexual encounter being roughly 1 week ago. In September, she completed her routine well women exam at a different clinic where she was found to have an abnormal Pap results and chlamydia, for which she was treated with azithromycin. Although her Pap smear results were abnormal, there were no high-risk types of HPV virus detected. Furthermore, 1 month ago, she was diagnosed at an urgent care center with a urinary tract infection and treated with Bactrim for 7 days. The urinary frequency overall has not improved since her urinary tract infection treatment, but she denies urgency, hesitancy, or burning. She describes the pelvic pain as a heavy dullness that comes and goes in her left lower quadrant and sometimes radiates to her lower back and improves with ibuprofen. As far as past medical history, Mrs. D is an overall healthy female with no known allergies and no previous history of hospitalizations, surgeries, or infusions. She states menarche at 15 years old, and her menstrual cycle is regular 28-day cycle with 4 days total duration and a heavy flow the first day that gradually becomes lighter towards the end. She denies use of barrier method but takes Junal Phi 120 daily for contraception, and her last menstrual period was January 23rd. The only other medication she's currently taking is the ibuprofen every 6 hours as needed for pain. Denies vitamins or herbal supplements. She is unaware of any family history of any illnesses, diseases, or cancers. She exercises 4 days a week, follows a regular diet, sleeps more than 8 hours every day, and is up to date on all vaccination. She does drink 1 to 2 alcoholic beverages every other day, smokes half a pack per day or less, and denies the use of any other drug use. Rule of systems. She denies fever, chills, anorexia, malaise, weight loss, or weight gain. She denies headache, dizziness, and lightheadedness. Denies any neck swelling or neck pain or any pain with neck movement. Denies blurry vision, double vision, loss of vision, itching, pain, or drainage. Denies earache, drainage, or tinnitus, loss of hearing, or fullness. Denies congestion, nosebleed, sinus pressure, and tenderness, bloody noses, loss of smell, but she does have seasonal allergies. She denies bleeding gums, toothache, and she brushes twice a day. Denies sore throat. She denies a history of respiratory problems, shortness of breath, cough, or wheezing. Denies history of any cardiac problems, chest pain, dyspnea, orthopnea, or palpitations. Denies nausea, vomiting, diarrhea, constipation, or abdominal pain. She had a recent urinary tract infection and chlamydia, but complains of increased foul-smelling vaginal discharge and urinary frequency. Denies a history of pregnancy, painful periods, bleeding between periods, or pain with intercourse. Denies any vaginal itching or urgency, hesitancy, or burning, flank pain, or suprapubic tenderness. Denies numbness, tingling, and syncope, back pain, arthralgia, myalgia, any rashes, or itching. As far as her assessment, her temperature was 98.1 orally, blood pressure was 121/83, pulse was 72, respiratory rate 16, height, she's 65 inches, weight 126.6, and BMI is 21.707. She is currently alert, oriented, pleasant, cooperative, well-groomed, well-developed, and self-reliable, and no acute distress. Head is normal cephalic, lips are smooth, no cracks, lesions, or sores. Mouth and throat are moist, pink, no exudate, sores, or lesions. Lungs are clear to auscultation bilaterally. Normal heart rate and rhythm. Abdomen is soft, slightly tender to palpation in left lower quadrant, but it's non-distended and has normal bowel sounds. Negative CVA tenderness. Urethral meatus is normal without discharge or irritation. The external genitalia is absent of lesions, bumps, lumps, and the vaginal walls are pink with scant shaven pubic hair. Vaginal mucosa is moist and slightly reddened with a moderate amount of thin, white to pale yellow odorous discharge. Her cervix is pink without lesions or masses. On her bimanual exam is negative for left lower pelvic tenderness, no palpable uterine or ovarian enlargement. Cervix is firm, round, and smooth with no cervical excitation. As far as in the office labs we did an office pregnancy test and urine dipstick that were both negative. We did a vaginal mucosal swab, pH swab, and the vaginal fluid is greater than 4.5, and the results of our urine culture are pending.